Okay, so I'm making this video for anyone out there who is considering getting an occipital nerve decompression surgery in Dallas, Texas with Dr. Amirlak. I'm going to be flying to Texas tomorrow for my surgery on Monday. Today's Friday the 20th of April. I have had migraines since I was in the 4th grade, so 11 years probably. I've been on medications since then. Pretty much, if you can name it, I most likely have tried it. I have tried acupuncture. I've tried, like I said, a bunch of medications. I've tried getting piercings. I got both of my daith piercings a couple weeks ago, maybe 2 weeks ago. I've tried Botox. I've tried nerve blocks both in the front and in the back. I've tried therapy, physical therapy, counseling, pretty much you name it, I've tried it. Basically, I wanted to make this as a kind of part one, a kind of before idea of what I am experiencing. I was a student at the University of Wyoming. I had migraines all growing up, starting, like I said, from the 4th grade. They really started to hit me harder, probably around 6th grade is when it really started, affecting my performance in extracurriculars and also in school. I just was absent a lot. I think I missed a really big portion of my sophomore year. I missed a lot of school days. I was missing school probably every 2 weeks because I would get sick with just, regular cold, and then I would get migraines. But they really didn't start getting bad until I went to college. I think that my freshman year of college I was doing better, and then my sophomore year, which was this past fall, and then I would still currently be in my sophomore year, it really started to hit me. I got the flu in September, and after that, probably October, September, October, end of October, I started getting a daily migraine. So every single day I would wake up and not have a migraine, I'd have a headache. And then at night, by the end of the night, or really after my classes, which really only lasted a couple hours in the morning, as soon as I got home, I pretty much would crash. I wouldn't be able to do homework, I wouldn't be able to study. It got to the point where I couldn't listen to music with words anymore when I was having migraines because any stimulation was just too much for me. And so my mother actually she was in a different state, and she flew down to college and was living with me, sleeping in my bed with me for a couple weeks, probably 2 or 3 weeks, which was pretty painful. And I actually had brought my dog with me to college. I had flown her with me as an emotional support animal because I thought maybe if my mental health was a little bit better, maybe my migraines wouldn't be as bad, and I'd be able to make it through, college, through that year of college. Well, that's not quite how it worked out. So my mom, my dog, and I were all sleeping in one full extra large full bed, which was not enough space, and we actually ended up packing up my entire apartment over the course of a couple of days, probably 3 days, and we drove back home, about like 1,000 miles we drove, and I didn't finish my semester. I was a couple weeks, 2 or 3, from finishing the semester, but I had missed so many classes, especially from having those daily migraines. I was barely making it to tests. I wasn't able to be making it to study groups with my friends. I really wasn't living a full life the way I wanted. And I wasn't able to exercise anymore. That was a big thing for me, was any exercise would give me a migraine, not only the day of exercising, but then the next morning when I woke up, I was always physically and mentally drained, and would have a migraine for sure the next day, guaranteed. Since then, I've been living at home with my parents. I'm unable to go to church anymore. The music and the pastor speaking, a lot of times he kind of, for emphasis, he raises his voice, and so he's really passionate about what he's doing, which is great, but it's really hard for me to sit through anymore. I can't really go outside anymore without wearing sunglasses because I get a migraine anytime it's too bright. Let's see, I had it wasn't an EKG. Was it I can't remember. Anyway, I had a scan done to test for seizures because I was having seizure-like activities at the peak of my migraines for a time, and so my mom and I went and I got tested for that, and it showed that I didn't have epileptic seizures, which is really good because it means that I can still drive. But got tested for that. I've had scans done, CAT scans of my head. I've had 2 of those in the last year. I've had blood draws, tested for kidney and liver issues. I've tried going gluten-free. I've tried going sugar-free, caffeine-free. I've tried a lot of different stuff. Could go on and on, but and lately I've been having to get nerve blocks done occipitally in the back in Seattle every 2 to 3 weeks, or else I am pretty much not making it through. I currently am on a medication called promethazine or prochlormethazine, and it's making me extremely exhausted. My blood pressure naturally is low. I usually have a pretty high heart rate and a pretty low blood pressure resting. Sorry if you can hear the dogs. But that has made it so that I have no energy. I'm really not even able to walk. Going shopping lately has been kind of exhausting. Sometimes when I get up and walk to the kitchen in the morning, I'm just immediately drained. I've started becoming paralyzed in my migraines where, let's say that somebody hands me something and I grab it and I drink from it, and then wherever I put it, I just hold my hands there, or sometimes I'm holding my hands in a spot and then they just ball up into fists and my toes curl. My mom has been driving me to the emergency room. I take a sumatriptan or Maxalt, I think, injection in my leg. I actually had to take one yesterday, and I have a bruise that's probably this big. It's not a really dark bruise, but it's kind of bluish, and it's really sensitive. It's really hard to walk after I take the shots. That's probably my most aggressive medication where I can inject myself, and I know that I'm going to hopefully get some relief. 19 out of 20 times I'm going to get relief. And that comes pretty quickly, as opposed to oral medications like ibuprofen, Tylenol, any nausea medication that I'm taking, like ondansetron. A lot of that are my rescue medications right now, but I'm taking them too often. Rizatriptan and sumatriptan are the two medications that have worked the best for me when I'm having a migraine. So as rescue medications as opposed to preventative medications. But you're only supposed to take them twice a week maximum, or else you can have muscle damage, and just it's not healthy for you to be taking them that often. And I in January was at a point where I was taking those medications almost every day, especially toward the end of, I'm so sorry, right before I left college and came back home, in order to make it to tests again, because it was the end of the semester. Everything was kind of piling up with lab exams and exams for classes before the final, and papers and projects, everything. I was taking those medications pretty much daily to get me through, and even then I would barely make it through when I needed to make it through, and then I would just plummet. I wasn't eating very often, again, because I had the flu in September. But anyway, I've gotten Botox twice. My first Botox was on December 28th, and my second one was this past month. March 28th was my second one. So I've had Botox only in the front the second time. I had that a couple weeks ago, and I really haven't noticed a difference from it. I've been experimenting with cannabis, CBD, THC, 3 CBD to 2, 3 to 2, maybe it's 4 to 3. Maybe it's 4 CBD to 3 THC drops. I've been experimenting with 2 drops, whereas it's safe to take up to 30 drops. And I haven't been getting psychedelic effects from that. I've just been getting, sometimes I don't have headaches, and then other times, sometimes it seems like it helps the rescue medications to work faster. Basically, my life right now has been put on hold. Like I said, my mom pulled me out of college. She helped me move back home. She didn't pull me out. But I had to drop out of college. And I wasn't able to finish my classes. I currently am not in school. I'm currently unable to work. I'm not reliable enough. I am really unreliable when it comes to hanging out with my friends as well, because a lot of times when it comes time for me to be doing something with them, I am unable to. I can't read lately. Reading is too much stimulation for my head and gives me a headache. I'm unable to work out, even doing a plank for 15 seconds, when I'm trying to do one for a minute. Once I hit about 15 seconds, my head hurts so bad that I know I have to stop. I can walk some, but even that's really exhausting. And yeah, everything else about me, really, I feel like I'm a pretty healthy individual otherwise, besides migraines. I definitely have depression, but besides that, migraines have really kind of taken over my life, and yeah. So anyway, I wanted to make a short little, this ended up being a long little video before I go to Texas and before I get the surgery. So this is my life before. Let's hope that there is some news after the surgery. Basically, my understanding of the surgery is there are 2 parts to the surgery. The first part is obviously one of the 2 surgeries, and then the second will be the other one, whichever you decide to start with, whether it's the front or the back. It really is based on where your migraines start. Because I have continuous headaches 24/7, doesn't matter. It's really hard for me to tell. And also because when I get a migraine, it hurts all over. That's another reason why I had the option to start with the front or the back. I'm choosing to start with the back surgery, which means that they're going to shave part of my head, I'm not sure how much. And they're going to remove some of that muscle around the nerves in my head, because the nerves being inflamed is what causes migraines. So giving those nerves a little more room is what they're trying to do. So they're going to take out some of that muscle and they're going to pad it with fat from, I think, lower my neck or around my shoulder area. And it's in 4 places. There's 2 kind of outer ones and then 2 a little bit at lower and further in. And then, so that's one surgery. They do that part, and then 2 months later they can do the other surgery, which will be on the front. And basically Dr. Amirlak does kind of the same thing, but he also removes a small nerve as well, which apparently helps a lot. And then if both of those don't work, I might have to have a 3rd surgery on my sinuses, but I'm really hoping that that's not the case. That might be a complication because I have pain behind my eyes and in my teeth when I do get migraines, which could be a sinus issue. But yeah, that's all so far.
Alright, I wish I had a different lens for this, but we're in the hospital place and we've been here for a couple hours now. It's around like 7:25 or something, I don't know. I have a migraine right now. We had to get here at 5 a.m. Yeah, thanks, friend. They took my vitals, took a pregnancy test. There's an IV in my arm. I had to take all my piercings out. They're probably going to have to remove the 8th piercing by cutting it if they need to. And that's all, I guess. Right?
Mm-hmm.
Surgery's going to take about 2 or close to 3 hours.
More like 4.
Oh, okay. It's going to take 4 hours. They're going to shave like arc kind of patch, I think, in the back of my head. We're waiting on the doctor, I guess, for a little more information. They're going to put me under anesthetic and I'm going to be fully out. And that's pretty much it. I'm hungry. I want coffee. My head hurts.